What criteria are used to classify a chronic disease, and how does classification influence the management plan? Answer: chronic diseases are typically classified based on several key criteria: duration, severity, and complexity. A chronic disease lasts for more than 3 months, often requiring ongoing medical attention and management. The classification process also considers the disease's etiology, pathophysiology, and the overall impact on the patient's quality of life. Diseases like diabetes, chronic obstructive pulmonary disease, COPD, and heart failure (HF) are prime examples, each exhibiting unique characteristics. The classification of chronic diseases is critical in shaping the management plan. For instance, a disease classified as high risk or severe may require intensive monitoring and a multidisciplinary care approach. This includes coordinated care among specialists, such as endocrinologists for diabetes, pulmonologists for COPD, and cardiologists for heart failure. Furthermore, classification guides the selection of evidence-based interventions, determining whether to implement lifestyle modifications, medication management, or advanced therapeutic options. The World Health Organization, WHO, emphasizes a standardized classification system to improve patient care outcomes. What role does a case manager play in managing a patient with congestive heart failure, CHF, and what are the core components of the CHF management plan? Answer: in managing a patient with congestive heart failure, CHF, the case manager plays a pivotal role as a coordinator of care, educator, and advocate. Their primary responsibility is to ensure that the patient receives comprehensive care that aligns with evidence-based practices. This involves collaborating with healthcare providers to develop and implement a management plan tailored to the patient's specific needs. The core components of a CHF management plan include medication management, symptom monitoring, lifestyle modifications, and regular follow-ups. The case manager ensures that the patient understands their medications, which often include diuretics, ACE, inhibitors, and beta blockers. They also educate patients on the importance of adhering to their medication regimen to prevent exacerbations. Symptom monitoring is crucial. The case manager encourages daily weight checks to detect early signs of fluid retention, which can indicate worsening heart failure. Additionally, lifestyle modifications such as dietary changes, sodium restriction, and appropriate physical activity are integral to managing CHF. Regular follow-ups with healthcare providers, including cardiologists, are essential to assess treatment efficacy and adjust medications as needed. Mr. Anderson, a 68-year-old patient with stage 4 lung cancer, is experiencing severe breakthrough pain despite being on a high-dose opioid regimen. What steps should the case manager take to ensure optimal pain management while considering the risks of opioid therapy? Answer: in managing Mr. Anderson's severe breakthrough pain due to stage 4 lung cancer, the case manager must adopt a comprehensive, multifaceted approach to optimize pain control while minimizing the risks associated with opioid therapy. First, a thorough assessment of Mr. Anderson's pain level, pain history, and response to the current opioid regimen is essential. This includes evaluating the effectiveness of his current medication dosage, timing, and any potential side effects he may be experiencing. One effective strategy is to consult with a pain management specialist or palliative care team to reassess his medication regimen. This may involve adjusting his opioid dosage, transitioning to a long-acting opioid for more consistent relief, and providing short-acting opioids for breakthrough pain. Furthermore, considering the addition of non-opioid analgesics such as NSAIDs or adjuvant medications like gabapentin or antidepressants can provide enhanced pain control. The case manager should also educate Mr. Anderson about the importance of regular pain assessment and reporting any changes in pain intensity or side effects. Given the potential risks of opioid therapy, including tolerance, dependence, and respiratory depression, regular monitoring for these side effects is crucial. How does a case manager promote patient empowerment in managing diabetes, and what strategies are most effective for encouraging self-management? Answer: promoting patient empowerment in diabetes management is a fundamental role of the case manager, as empowered patients are more likely to engage actively in their care, leading to better health outcomes. To effectively promote empowerment, the case manager employs several strategies aimed at educating and involving the patient in their diabetes management. Firstly, education is paramount. The case manager provides comprehensive information about diabetes, including its pathophysiology, the significance of blood glucose monitoring, dietary considerations, and the importance of medication adherence, utilizing teach-back methods, where patients explain the information back to the case manager. can confirm their understanding and retention of essential concepts. Secondly, the case manager facilitates goal setting, encouraging patients to set realistic and achievable health goals, such as maintaining blood glucose levels within target ranges or incorporating physical activity into their daily routine. This collaborative approach fosters a sense of ownership over their health and motivates patients to engage in self-management behaviors. Additionally, the case manager may introduce behavioral interventions, such as motivational interviewing techniques that explore and resolve ambivalence regarding lifestyle changes. Providing access to diabetes self-management programs or support groups also reinforces the importance of social support in sustaining behavioral changes. Research, including findings from the Stanford Chronic Disease Self-Management Program (CDEMPA), demonstrates that when patients are educated and supported in making informed decisions, they experience improved health outcomes, greater satisfaction with their care, and enhanced quality of life. Overall, a holistic approach that integrates education, support, and goal setting is vital for empowering patients to manage their diabetes effectively. What are the legal components of informed consent in chronic disease management, and how does failure to obtain informed consent impact patient care? Answer: informed consent is a foundational principle in healthcare, especially critical in the management of chronic diseases. It is a legal and ethical requirement that ensures patients are fully aware of the nature of their condition, the proposed treatment options, potential risks and benefits, and any alternatives available. Key components of informed consent include disclosure. The healthcare provider must communicate all relevant information in a manner the patient can understand, ensuring clarity on treatment options and potential consequences. Competence. The patient must be mentally capable of understanding the information presented, making decisions regarding their care. Voluntariness. The decision to accept or refuse treatment must be made freely without coercion or undue pressure. Failure to obtain informed consent can lead to serious repercussions, including legal liabilities such as claims of negligence or malpractice. It may also diminish the trust in the patient-provider relationship, leading to decreased adherence to treatment plans and poorer health outcomes. Legal precedents, such as those outlined in the Patient Self-Determination Act, emphasize the importance of respecting patient autonomy and rights. In the context of chronic disease management, where treatment often involves complex and long-term interventions, obtaining informed consent is not merely a legal formality, it is an essential process that ensures patients are active participants in their healthcare journey, ultimately fostering better outcomes and adherence to treatment protocols. Mrs. Parker, a 55-year-old patient with COPD, is hesitant to follow her pulmonologist's recommendation for oxygen therapy, citing concerns about the inconvenience and stigma. What approach should the case manager take to support shared decision-making in this case? Answer: in managing Mrs. Parker's hesitance regarding the recommendation for oxygen therapy, the case manager should prioritize a shared decision-making approach that respects her concerns and promotes her autonomy. The first step is to conduct an empathetic conversation, allowing Mrs. Parker to express her fears about the inconvenience and potential stigma associated with oxygen use. Understanding her perspective is critical in building rapport and trust. Next, the case manager should provide balanced, evidence-based information about the benefits of oxygen therapy, including its role in improving her quality of life, preventing exacerbations, and enhancing her overall functionality. Discussing how oxygen therapy can enable her to engage more fully in daily activities and social interactions may alleviate some of her concerns. Exploring alternatives is also vital. The case manager can discuss various oxygen delivery options, such as portable oxygen concentrators that allow for mobility and flexibility in daily life. By emphasizing that the treatment can be tailored to her lifestyle, the case manager helps Mrs. Parker feel more in control of her care decisions. Finally, the case manager should encourage Mrs. Parker to engage in goal setting related to her health management, fostering a sense of ownership. Encouraging her to reach out to support groups or other patients using oxygen therapy can help normalize her experience and reduce feelings of stigma. Shared decision-making, as highlighted in guidelines from the American Thoracic Society, enhances patient engagement, adherence to treatment, and overall satisfaction with care, making it an essential strategy in chronic disease management. Why are evidence-based interventions critical in managing chronic diseases, and what are some common examples of these interventions in practice? Answer: evidence-based interventions are critical in managing chronic diseases as they ensure that patient care is grounded in the best available research, clinical expertise, and patient preferences. These interventions aim to improve patient outcomes, enhance the quality of care, and reduce healthcare costs by utilizing strategies proven effective through rigorous studies. Common examples of evidence-based interventions in chronic disease management include medication adherence programs, lifestyle modification initiatives, and patient education. For instance, in diabetes management, interventions such as the Diabetes Prevention Program (DPP) focus on lifestyle changes including diet and exercise to prevent the onset of type 2 diabetes in at-risk individuals. This program is based on extensive research demonstrating its effectiveness in reducing diabetes incidence. Another example is the use of standardized care pathways for conditions like chronic obstructive pulmonary disease (COPD) and heart failure. These pathways provide clinicians with a structured approach to patient assessment, treatment, and follow-up, promoting consistency and adherence to best practices. Moreover, chronic disease management programs often employ telehealth strategies to facilitate regular monitoring and communication between patients and healthcare providers. Evidence shows that such approaches can enhance patient engagement, improve adherence to treatment plans, and lead to better management of chronic conditions. Organizations like the Centers for Disease Control and Prevention (CDC) and the World Health Organization, who advocate for the integration of evidence-based practices into chronic disease management to ensure effective and patient-centered care. Overall, these interventions are instrumental in achieving optimal health outcomes for patients with chronic diseases. Discuss the importance of interdisciplinary collaboration in the management of patients with chronic diseases and provide examples of effective team strategies. Answer: interdisciplinary collaboration is crucial in the management of patients with chronic diseases due to the complexity and multifaceted nature of these conditions. Such collaboration involves a coordinated approach among healthcare professionals from various disciplines, including physicians, nurses, pharmacists, dietitians, social workers, and case managers. This teamwork enhances patient care by ensuring comprehensive assessments, individualized treatment plans, and consistent follow-up. One important strategy in interdisciplinary collaboration is the establishment of a multidisciplinary care team where each member brings their unique expertise to the table. For example, in managing a patient with diabetes, a primary care physician may oversee medical management, while a dietitian develops a personalized meal plan and a diabetes educator provides patient education on self-monitoring and lifestyle modifications. Regular team meetings can facilitate communication, allowing team members to share updates on the patient's progress and make necessary adjustments to the management plan. Additionally, utilizing care coordination models, such as patient-centered medical homes (ECMH) or accountable care organizations (ACO), can enhance collaboration. These models promote comprehensive, team-based care focused on the patient's needs, ensuring that all aspects of their health are addressed in a coordinated manner. Research indicates that interdisciplinary collaboration leads to improved health outcomes, higher patient satisfaction, and reduced hospital readmissions. The Agency for Healthcare Research and Quality (AHRQ) highlights the effectiveness of team-based care in managing chronic diseases, underscoring its significance in delivering quality healthcare. How does health literacy impact the management of chronic diseases, and what strategies can case managers employ to enhance patient education? Answer: health literacy significantly impacts the management of chronic diseases as it affects patients' ability to understand health information, follow treatment plans, and make informed decisions about their care. Patients with low health literacy may struggle with comprehending medical instructions, which can lead to poor adherence to treatment regimens, ineffective self-management, and ultimately worse health outcomes. To enhance patient education and improve health literacy, case managers can employ several strategies. Firstly, simplifying communication is essential. Using plain language and avoiding medical jargon when explaining diagnoses, treatment options, and self-care practices can help patients grasp crucial information. Visual aids, such as diagrams, videos, and infographics, can further enhance understanding by illustrating complex concepts in a more digestible format. Additionally, case managers should assess patients' baseline health literacy and tailor education accordingly. Utilizing teach-back techniques where patients are asked to explain back what they have learned can confirm understanding and identify areas needing further clarification. Incorporating technology such as mobile health applications and online resources can also facilitate ongoing education and engagement. These tools can provide patients with easy access to information about their conditions and management strategies, promoting self-efficacy and empowerment. Finally, fostering a supportive environment that encourages questions and discussions about health concerns can enhance patient engagement. By actively involving patients in their care through personalized education and support, case managers can significantly improve health literacy, leading to better management of chronic diseases. Explain the significance of cultural competence in chronic disease management and provide examples of how case managers can address cultural differences in patient care. Answer: cultural competence is a crucial component of effective chronic disease management as it acknowledges and respects the diverse backgrounds, beliefs, and values of patients. Understanding cultural differences can significantly impact how patients perceive their health conditions, make decisions about their care, and adhere to treatment plans. A culturally competent approach enhances communication, builds trust, and fosters a supportive patient-provider relationship, which is essential for optimal health outcomes. To address cultural differences in patient care, case managers can implement several strategies. First, conducting thorough cultural assessments is vital to understanding the patient's background, including language preferences, health beliefs, and practices related to their condition. This knowledge allows case managers to tailor interventions and communication styles to align with the patient's cultural context. Second, employing interpreters or bilingual staff can bridge language barriers, ensuring that patients fully comprehend their health information and treatment options. Additionally, offering educational materials in multiple languages can enhance accessibility and understanding. Third, case managers should engage patients in discussions about their cultural beliefs regarding health and illness, respecting traditional practices that may complement medical treatments. Collaborating with community organizations that focus on specific cultural groups can also facilitate outreach and education tailored to those communities. Finally, continuous training in cultural competence for healthcare providers is essential to cultivate an inclusive environment that values diversity. Organizations such as the National Center for Cultural Competence provide resources and training programs to support healthcare professionals in delivering culturally responsive care. Overall, by prioritizing cultural competence, case managers can enhance patient engagement, improve adherence to treatment, and ultimately lead to better management of chronic diseases. What are the key differences between HIPAA privacy rule and HIPAA security rule in terms of patient confidentiality and data protection in case management? Answer: the HIPAA privacy rule focuses on protecting all forms of protected health information, whether it's written, oral, or electronic. It ensures that healthcare providers and other covered entities protect patient confidentiality by controlling how PHI is used and disclosed. The HIPAA security rule, on the other hand, specifically governs electronic PHI-FI. It sets standards for safeguarding electronic health records through administrative, physical, and technical measures. The security rule requires encryption, secure access control, audit trails, and regular assessments of FI security practices. Understanding both rules is essential for case managers, as they must ensure that patient information is handled appropriately and any breaches or unauthorized access are promptly addressed. Dr. Emily Parker is a case manager overseeing a patient, Mr. Roberts, who recently suffered a stroke. Mr. Roberts is unable to communicate effectively and has not signed any advance directives. His family is divided on whether to pursue aggressive treatment. What ethical and legal principles should Dr. Parker follow to ensure Mr. Roberts' rights are respected? Answer: in this scenario, Dr. Parker should follow the principles of informed consent and advance directives. Since Mr. Roberts is incapacitated, the lack of an advance directive presents a challenge. Informed consent requires healthcare professionals to respect a patient's autonomy in decision-making, but in the absence of clear communication from the patient, Dr. Parker must rely on legal surrogates or family members. The case manager should facilitate a substituted judgment process where family members make decisions based on what Mr. Roberts would have chosen. If the family remains divided, the hospital's ethics committee may be involved to mediate the decision. Dr. Parker must also ensure that all decisions align with applicable state laws on patient rights and surrogate decision-making. Describe the role of continuous quality improvement (CQI) in case management and explain how it helps in achieving better patient outcomes. Answer: continuous quality improvement (CQI) is a systematic, data-driven approach aimed at improving healthcare processes and patient outcomes in case management. CQI focuses on analyzing performance metrics and identifying areas for improvement in patient care coordination, discharge planning, and follow-up care. It emphasizes the Plan Do Study Act (PDSA) cycle, which involves plan, identifying areas of need, and creating strategies to address them. Do implementing changes to care processes, study, monitoring outcomes and analyzing data to determine if improvements occurred, act, refining the plan based on the results and scaling successful strategies. By continuously refining processes, CQI helps case managers ensure that care is more efficient, cost-effective and aligned with best practices, leading to improved patient outcomes and satisfaction. What are the URAC and NCQA accreditation standards for case management, and how do they impact the quality of care provided? Answer: URAC Utilization Review Accreditation Commission and NCQA National Committee for Quality Assurance are two major accrediting bodies that set standards for case management practices. URAC focuses on evaluating the performance of healthcare organizations in areas such as patient advocacy, quality improvement, and compliance with industry standards. Its case management accreditation ensures that care coordinators meet certain benchmarks for patient education, discharge planning, and care transitions. NCQA, on the other hand, emphasizes a structured, evidence-based approach to improving patient outcomes. Its accreditation program assesses how well case managers implement care coordination, patient-centered care plans, and preventive services. Both URAC and NCQA ensure that case management programs maintain high standards for patient safety, service efficiency, and clinical quality, which in turn improve the overall care experience and patient outcomes. Mr. James, a 65-year-old diabetic patient, has been readmitted to the hospital twice in the last 6 months due to complications related to poor medication adherence. As his case manager, how can you apply outcomes-based care principles to reduce his remission rate and improve his long-term health outcomes? Answer: in outcomes-based care, the focus is on achieving specific, measurable improvements in patient health. For Mr. James, the case manager should assess the root cause of his medication non-adherence, which could be financial, educational, or due to cognitive decline. Develop an individualized care plan that includes patient education on the importance of medication adherence, simplified medication regimens, or setting up reminders for taking medications. Implement interventions such as enrolling Mr. James in a medication management program, coordinating with pharmacists, and utilizing home health services if necessary. Monitor outcomes by tracking his health indicators, e.g., HbAC levels and adherence rates, using these metrics to adjust the care plan as needed. Through consistent follow-up and engagement, the goal is to reduce hospital readmissions and improve Mr. James' long-term health. Explain the role of value-based purchasing (VBP) programs in case management and how these programs align with patient care objectives. Answer: value-based purchasing (VBP) programs are initiatives by healthcare payers, including Medicare, that tie reimbursement to the quality of care provided rather than the volume of services. In case management, VBP programs align with patient care objectives by encouraging a focus on preventive care and reducing avoidable hospitalizations, promoting the use of evidence-based guidelines to ensure consistent, high-quality care, holding case managers accountable for patient outcomes such as readmission rates, patient satisfaction, and overall health improvement. By rewarding case managers and healthcare providers for delivering effective care, VBP programs aim to enhance care coordination, improve patient outcomes, and control healthcare costs. What is the legal implication of a case manager's failure to obtain informed consent before coordinating a patient's care, and how does this relate to risk management? Answer: failure to obtain informed consent exposes the case manager and the healthcare institution to potential legal liability. Informed consent is a legal and ethical obligation that ensures patients understand their treatment options, the associated risks, and can make autonomous decisions regarding their care. In case management, neglecting informed consent may result in claims of medical negligence or battery if treatments are administered without the patient's knowledge. From a risk management perspective, it is crucial for case managers to document consent properly to avoid litigation and to safeguard patient rights, ensuring transparency and trust in the patient-caregiver relationship. MS. Garcia, a case manager, is helping a low-income family access community health resources. The family needs long-term care for an elderly member with Alzheimer's disease, but is concerned about the cost. What actions should MS. Garcia take considering the principles of evidence-based practice and population health management? Answer: MS. Garcia should utilize evidence-based practice by identifying community resources and support services that have proven to be effective for Alzheimer's patients, such as memory care programs and respite care services. Additionally, she should apply population health management strategies by connecting the family with local health departments or charitable organizations that offer subsidies for low-income families. ensuring that the care plan is coordinated across multiple providers, including social workers and specialists, to manage the elderly member's condition efficiently and cost-effectively, educating the family on long-term care insurance options and other financial support programs like Medicaid. By leveraging these approaches, MS Garcia can help the family navigate their financial constraints while ensuring the patient receives appropriate and sustainable care. What are the key components of patient satisfaction measures in case management, and how do they influence quality improvement initiatives? Answer: key components of patient satisfaction measures include communication with healthcare providers. Patients value clear, transparent discussions about their health care plans and treatment options. Timeliness of care. Delays in receiving treatment or services can negatively impact patient satisfaction. Coordination of care, ensuring seamless transitions between different levels of care, e.g., hospital to home, is critical for positive experiences. Patient empowerment and involvement. Patients who are actively involved in their care decisions tend to report higher satisfaction levels. These measures directly influence quality improvement (CAI) initiatives by highlighting areas where patient care can be enhanced, such as improving communication or reducing wait times, ultimately driving better outcomes and higher patient engagement. Discuss the significance of fraud, waste, and abuse prevention in healthcare case management, and outline effective strategies case managers can implement to minimize these risks. Answer: fraud, waste, and abuse prevention is crucial in healthcare case management as it ensures the integrity of the healthcare system, protects patient rights, and maintains cost effectiveness. The impact of FWA can lead to increased healthcare costs, reduced access to necessary services, and harm to patient trust in the system. Effective strategies case managers can implement to minimize these risks include training and education, regularly educating staff about FWA types, red flags to watch for, and the importance of reporting suspicious activities. This creates a culture of awareness and responsibility. Robust documentation practices, maintaining accurate and thorough documentation of all patient interactions, treatment plans, and billing codes to prevent discrepancies that could indicate fraud or abuse. Auditing and monitoring, conducting regular audits of claims and billing practices to identify unusual patterns that may suggest fraud or waste, ensuring compliance with regulations. Establishing reporting mechanisms, creating confidential channels for employees and patients to report suspected FWA without fear of retaliation, fostering an environment of accountability. Explain the role of case management in interdisciplinary teams and how it contributes to patient-centered care. What are the key challenges case managers face in this environment? Answer: case management in interdisciplinary teams plays a crucial role in ensuring continuity of care across multiple disciplines such as nursing, social work, and medical specialties. Case managers act as liaisons, facilitating communication, coordination, and collaboration between various healthcare providers. This ensures that patient care is holistic and aligned with the individual's needs and preferences, which is a hallmark of patient-centered care. The key challenges faced by case managers include fragmentation of care. Coordinating multiple providers can lead to gaps or overlaps in care, affecting patient outcomes. Conflicting goals. Different disciplines may have divergent priorities, e.g., cost control versus quality improvement. Communication barriers. Miscommunication or lack of timely information sharing can result in delayed or inappropriate care. Effective case managers navigate these challenges by leveraging strong communication skills, setting clear care goals with the team, and using tools such as electronic health records to track patient progress and share updates. Mr. Roberts, a case manager, is coordinating care for a 65-year-old patient with multiple chronic conditions. The patient's primary care physician recommends a treatment that conflicts with the recommendations from the patient's cardiologist. What should Mr. Roberts do to ensure the best outcome for the patient? Answer: in this scenario, Mr. Roberts must act as a mediator between the two healthcare providers. The steps he should take include facilitating communication, arrange a meeting or conference call between the primary care physician and the cardiologist to discuss their differing recommendations, clarifying the patient's preferences, ensure that the patient's wishes and priorities are at the center of the decision-making process, consulting evidence-based guidelines, review clinical guidelines and current evidence for managing patients with multiple chronic conditions to provide a balanced perspective, documenting the decision-making process. All communications and decisions should be recorded in the patient's EHR to maintain transparency and ensure continuity of care. By promoting collaboration, Mr. Roberts ensures that the interdisciplinary team can arrive at a consensus that prioritizes the patient's health and well-being. What are the ethical obligations of case managers in maintaining data security and confidentiality when using electronic health records (EHR) systems? Answer: case managers have a duty to ensure that patient information is kept confidential and secure when using EHR systems. Key ethical obligations include access control, limiting access to patient information to authorized personnel only, ensuring that healthcare providers have access on a need-to-know basis. Compliance with HIPAA, adhering to the Health Insurance Portability and Accountability Act (HIPAA), which mandates the protection of patient information through encryption, secure storage, and restricted sharing. Informed consent, ensuring patients understand how their health data will be used and obtaining consent before sharing it with other parties. Regular security audits, participating in or initiating audits to assess the security protocols in place and address vulnerabilities. Failure to adhere to these obligations can result in breaches of confidentiality, leading to legal penalties, loss of patient trust, and harm to the patient. To discuss the impact of mobile health (mHealth) apps on case management. How can case managers effectively integrate these tools into patient care? Answer: mobile health apps have revolutionized case management by improving patient engagement, monitoring, and communication. These apps can track patient behaviors, e.g., medication adherence, physical activity, provide educational resources, and offer direct communication channel between patients and case managers. To effectively integrate mHealth apps into patient care, case managers should assess the patient's tech literacy, ensure that patients are comfortable using the app and provide necessary training or support, select appropriate apps, choose apps that are evidence-based and compliant with data security standards such as HIPAA, set clear goals, use the app to monitor specific outcomes like medication adherence or symptom tracking, and regularly review the data collected, coordinate with healthcare providers. Share relevant data from the app with the interdisciplinary team to enhance clinical decision-making. When used properly, mHealth apps can increase patient engagement and improve outcomes, especially in chronic disease management. Mrs. Harris, a case manager, is managing a patient recovering from surgery. The patient lives in a rural area and cannot frequently visit the clinic. The patient expresses frustration with telehealth services due to poor internet access. How should Mrs. Harris address this situation? Answer: Mrs. Harris should first acknowledge the patient's frustration and explore alternative solutions to ensure continuity of care despite the limitations of telehealth. Steps include connecting the patient with local resources, identify nearby community clinics or services that offer in-person support for those with limited internet access, exploring hybrid models, schedule occasional in-person visits to supplement telehealth check-ins or offer telephone-based consultations as an alternative, advocating for technology support. If possible, Mrs. Harris can advocate for the patient to receive assistance with improving internet access either through local programs or grants aimed at rural areas. By taking a flexible and patient-centered approach, Mrs. Harris can ensure that the patient receives the necessary follow-up care without being overly burdened by technological limitations. What is predictive modeling in case management and how does it enhance patient care? Answer: predictive modeling in case management uses data analytics to forecast patient outcomes based on historical and current data. This tool can help case managers identify patients at high risk for readmission, poor outcomes, or complications, allowing for proactive interventions. Benefits include targeted interventions. By predicting which patients are likely to need more intensive care, case managers can allocate resources more efficiently. Improved patient outcomes. Early identification of at-risk patients enables case managers to implement preventive measures, reducing hospitalizations and improving health outcomes. Cost reduction. Predictive modeling helps healthcare organizations avoid unnecessary treatments and hospital stays, leading to cost savings. Predictive modeling is especially useful in managing chronic conditions where early interventions can significantly alter the patient's health trajectory. Explain the role of professional organizations such as CMSA and ACMA in the professional development of case managers. Answer: professional organizations like the Case Management Society of America (CSA) and the American Case Management Association (ACMA) provide resources, networking opportunities, and continuing education for case managers. These organizations offer certification programs, help case managers meet licensure and certification requirements, ensuring professional competency, provide advocacy, represent case managers in healthcare policy discussions, and promote best practices in case management. Promote professional development. offer workshops, conferences, and online courses to help case managers stay current on industry trends and regulations, facilitate networking, provide platforms for case managers to connect, share experiences, and collaborate on complex cases. Membership in these organizations supports lifelong learning and helps case managers maintain high standards of practice. Mr. Thompson, a case manager, is facing burnout after managing an extremely high caseload for several months. His work performance has begun to suffer and he feels overwhelmed. What strategies should Mr. Thompson implement to prevent further burnout and improve his well-being? Answer: Mr. Thompson should consider several self-care and workload management strategies to address his burnout. Delegate tasks. Where possible, Mr. Thompson should delegate administrative tasks to support staff, freeing up time for patient-centered activities. Set boundaries. He should set clear work hours and avoid working overtime regularly to maintain work-life balance. Prioritize self-care. Engaging in regular physical activity, mindfulness practices, and seeking support from a counselor or peer group can help him manage stress. Time management techniques. Mr. Thompson should use time management tools, e.g., prioritization matrices, to focus on high-impact tasks and avoid becoming overwhelmed by low-priority issues. By implementing these strategies, Mr. Thompson can protect his well-being and maintain a high level of professional performance. Discuss the benefits and limitations of telehealth in case management, particularly for managing patients with chronic illnesses. Answer: Telehealth offers significant benefits in case management, particularly for chronic illness management. Accessibility: it enables case managers to reach patients in remote or underserved areas, reducing barriers to care. Convenience: patients can receive follow-up care from the comfort of their homes, improving adherence to care plans. Cost efficiency: telehealth reduces the need for frequent in-person visits, lowering healthcare costs. However, there are limitations. Technological barriers: patients without reliable internet access or those unfamiliar with technology may struggle to engage with telehealth. Lack of physical assessment: certain conditions may require in-person evaluation, limiting telehealth's effectiveness. Privacy concerns: ensuring data security and patient privacy in telehealth interactions remains a challenge. What are the implications of self-care and burnout prevention for case managers, and how can organizations support their staff in these areas? Answer: self-care and burnout prevention are vital for case managers as they work in high-stress environments managing complex patient needs. The implications include increased job satisfaction. Case managers who engage in self-care are more likely to feel fulfilled and motivated, leading to better performance. Improved patient outcomes. A well-rested and mentally healthy case manager is better equipped to provide high-quality care, reducing the risk of errors and improving patient satisfaction. Retention rates. Organizations that prioritize employee well-being are likely to experience low turnover rates, saving costs related to hiring and training new staff. Organizations can support case managers by providing mental health resources. Access to counseling, support groups, or stress management workshops can help staff cope with the demands of their roles. Promoting work-life balance, encouraging flexible work hours and manageable caseloads can reduce stress. Implementing wellness programs. Initiatives such as fitness classes, mindfulness training, and regular health assessments can foster a culture of health and wellness.